so we have a baby girl. Her name is Lucy, so I'm going to perform hand hygiene. And I'm going to put on my gloves. So you want to have gloves on when we touch a newborn baby. Okay, so I'm receiving the baby. Her name's Lucy. I'm going to be cleaning her off. Okay, and then we're going to set up our scale. We're going to zero it out with a blanket. Get on my knees. All right, so we're going to do pounds and ounces for the mom and the parents, and then we're going to do kilograms for us because that's what we care about. Okay, we weighed her. And then side rails up for safety for the baby. And then, I guess that's better, okay. We're gonna go ahead and measure her. It's my tape measure. So we're gonna do length in inches and centimeters for us. Okay, so we're gonna do the total length and we're gonna do her head circumference. Okay, right above her eyebrows. Okay, and then we're going to do her chest circumference. Okay. And then we're going to do her abdomen, her belly. Okay, and that's good for measurements, I believe. And then with my stethoscope, I'm going to go ahead and begin listening to her to get some vitals. Okay. So we're gonna do her heart rate, and it's 140, so that's good. And then I'm gonna go ahead and do her respirations, and it is 45, so that's okay too. And then I'm gonna listen to her bowel sounds. And they are active in all 4 quadrants, so that's great. And then, oh, I also want to listen to her backside too. And she has good breath sounds for just being born as well. Okay. All right, and then we're gonna take her temperature with an axillary reading. Okay, and I get 98.0 Fahrenheit, so that's good. Warm. Okay, then we're just going to begin our newborn assessment now. So we're going to start with her skin. She's pink, she's crying, she's moving, everything looks great there. So the texture is smooth. I don't see any lanugo on the back of her arms or on her back. So I don't see any hair, and I don't see any vernix either. She didn't have a whole lot of vernix coming out of the mom. And I'm not seeing any skin spots or rashes or Mongolian spots anywhere on her. So she's pretty fair skinned. Don't see any blemishes, so that's good. And then we're gonna go ahead and start with her reflexes now. And so, these are hard. So I'm just gonna go with the Moro reflex, so that I'm just gonna snap my fingers, and she looks like she's reactive to them. And then, so the blink reflex, she's blinking, and I'm also gonna test her pupillary reflexes. So they're both constricting equally. Great. And then I'm gonna go ahead and test her rooting reflex. So I'm just gonna touch her left side, and she's turning to the left. And I'm gonna touch her right side, and she's turning to the right. And then after that, I'm gonna go ahead and test her sucking reflex, and I feel her sucking on my finger. And then with my finger, with my glove, I'm gonna just feel her soft and her hard palate, and those feel normal with that. And then I'm gonna have her grasp my fingers with her palms, the palmar reflex, and then I'm gonna do the same thing with her toes, and she is doing that too. And then with the Babinski, I'm just going to the heel to the toes, and her toes are spreading when I do that. So that's a good finding. And then I'm going to her trunk incurvation. So I'm just going to touch her left side and she's going to turn that side. I'm going to touch her right side and she's going to turn that side as well for the trunk incurvation. And then for the fencer, so if I turn her to her left side, her arm is going to go up on that same side, and if I turn her head the other side, her right arm will also go towards that side, and the other arm, the opposite arm, will stay bent at the elbow. So that's good for that. And then for the prone crawl, you would place the baby on their stomachs, and then I guess they would try to crawl and move their buttocks. So that's good. And then for the stepping reflex, so if you hold the baby vertical, they can't walk yet, but it's gonna look like they're walking. And I think I did all the reflexes. Okay. And then, so after the reflexes, we're gonna assess the head. And so I'm feeling the anterior and posterior fontanelles, and they're both flat. There's no bulging on the head anywhere. She has a very round head. So sometimes she can have a cone head looking after a vaginal delivery, which I don't see that with her. And I don't see any swelling or edema, so no capids, I think that's how you say it. And then, no, I don't see any blood blisters on the head, so no cephalohematoma on her scalp. I don't see any of that, so that's great. And then for her face is very symmetrical. She was not a forceps baby, so there's no lacerations on her face. She didn't have any use for the vacuum, but if she were, maybe she would have bruising on her head, which I'm not seeing, so that's good. And then I don't see any milia on her face, by her nose or anything. Any enlarged sebaceous glands she doesn't have, so that's all good for her face. And then we're gonna get to the nose. I'm just gonna assess the patency, so I'm just gonna hold one nostril and she can breathe out the other one, and then I'm gonna test the other one, and they're both patent, so that's great. And then for the ears, they align with her outer canthus of her eyes to her ears, so that's great. And I can see into the canals of each one. And when mom is talking off to the distance, she keeps turning her head, so I'm confident that she has good hearing right now. So the hearing test, she's listening to her mom and to their surroundings. She's turning and reacting from those. And then her mouth, it is symmetrical. Her tongue is moving everywhere. I already assessed her soft and hard palate, and so those were good. It's symmetrical. And then her eyes, and so they're both symmetrical. They're in the same placement. They look the same. She has a white sclera. Looking at her corneas, she has eyelids that are covering her eyes. She has eyelashes that are evenly distributed. Let's see what else. She's moving them. She has good coordination of her vision, and she is reacting to objects that we put in front of her, so we believe she has appropriate vision for a newborn. And her conjunctiva is nice and pink, so I'm not thinking any infection, so it's good there. And then her neck, I guess I should hold like that. Her neck is very short and she's still moving them, and I'm just gonna palpate her clavicles to make sure there was no trauma during her delivery, which I don't feel any trauma, so that's good. That's what we want. And then for her chest, she is listened to her breath sounds already. She has good expansion. I don't see any retractions. Let's see here. She was a full-term baby, and so her nipples are a little elevated, which is to be normal. If it was a preemie, she could have had flat nipples, but hers are elevated because she was term, so that's good. And then her abdomen, she has a clamp on her umbilicus, and I'm gonna feel for her femoral pulses, which they're very good and strong. And then I don't see any inguinal hernias or any bulging in that area either, so that's good. We don't want to see that. And then just for her extremities and her trunk, she's moving great. She's flailing, she's moving everything. She's moving her neck, her arms, her hands. Her spine is C-shaped. She's moving her legs, her feet, her toes. She's got 5 fingers, 5 fingers, 5 toes, 5 toes, so everything looks great there. She's got good flexion and extension for what she has as a newborn, so that's what we want to see. And then we do have a female, and so we're just going to assess her genitalia. She's got the mons, the clitoris, and then the vagina, and so those look normal for a newborn, for a baby girl. If we had a boy, we would assess the penis, the scrotum, and then the testes, and just seeing if those have dropped yet, and if not, to note of that. And then for her elimination pattern, so she was born an hour ago, so we have a 1-day baby, and so we would expect her to have at least 1 wet diaper today. That's what we want. And then tomorrow 2, 3 the 3rd day, 4 the 4th day, and then after that we want at least about 6 to 10 wet diapers every day. Her urine is very clean because she did urinate, but she has not had a bowel movement yet today, but she has active bowel sounds. So we would expect the first 2 bowel movements to be kind of sticky, so just to document that whenever she does. And then I don't see any jaundice, but we'll still run some tests with her bilirubin, and so she would just have physiological jaundice, which is normal for a newborn. We don't want pathological jaundice. That could be bad. And I think that's everything. Okay, now we're just gonna give her back to her mom.